Okay, guys, Dr. Tom is back. Aloha. We're on slide 37, chapter 1, medical terminology 1. We left off with x rays. Radio or radiology has to do with x rays. I know it sounds like radio, but it's not. Radio waves and x rays are both electromagnetic radiation, but there's a huge difference in the amount of energy they have. So, radiology is. It's x-rays, but actually it's medical imaging now, guys, because they have a lot of newer stuff like MRIs and so forth. Rhino means nose. Rhinoplasty is a nose job, like a plastic surgery gives you. How do I remember? Think of a rhino having that big horn coming off the nose. Sarcoma means flesh. Sarcoma is a cancer of connective tissue. It says skin tumor, but yeah. Sarcoma means flesh. Thrombo means clot, as in blood clot. That's a very important one. A thrombus is a blood clot. Very serious, leading cause of death in strokes, heart attacks. Ophthalmo means the eye. Excuse me. I'm drinking a diet soda to lubricate my throat, and it's making me burp. Ophthalmologist is an eye doctor. Now, there's also an optometrist. They're an eye doctor too. They're not an MD, but they fit prescription lenses and screen for disease and all that. But if you have to have surgery or something serious done, an ophthalmologist does it. Cerebral is the cerebrum, which is the biggest portion of the brain where higher thinking and logic and all takes place. Encephalo also means brain. Encephalitis is swelling of the brain. Why? Itis means inflammation, swelling. Cysto, we've touched on it already. This is the urinary bladder. If you've ever had a bladder infection or a urinary tract infection, it gets up in the bladder. Cystitis is what that's called. Now, see, here's an example where itis means infection, just like I said. Hepato means liver. Hepato is the root word for liver, very important. Hepatitis is inflammation or infection of the liver, often caused by excessive alcohol consumption. Urethral means red. Most commonly, you'll see this describing red blood cells, which are called erythrocytes. Leuco means white. The white blood cells are called leukocytes. These are important. You have to know these. Urethral red, leuco means white. There are also some other colors. Those are the big. Cyano, for example, with a C, means blue. Okay, suffixes. Suffixes come at the end of the word. ACAL, pertaining to. With this kind of thing, guys, you pretty much just have to see how it's used in context. Algia is the suffix that means pain. Algia means pain, very important. So what's myalgia? It's muscle pain. A headache would technically be called cephalgia, because cephalo means head. Okay, cyte means cell. Myocyte is a muscle cell. Ectomy means surgical removal or excision. A tonsillectomy is where they take your tonsils out. A hysterectomy is where they take the female uterus out. All these are important to know. More suffixes. Emia means something to do with blood. Like anemia means you don't have enough blood or you don't have enough of certain components of the blood. Genic means to make or produce, just like Genesis in the Bible. Osteogenic means something that's made in bone. Why osteo means bone. Globin is a type of protein. Hemoglobin is an important protein in the blood that transports oxygen, carbon dioxide. Gram is to record or print something. We already mentioned that with an EKG or ECG. Printout of heart electrical activity. Now, guys, let me comfort you here. Each chapter in medical terminology, you're not going to have to learn more and more and more of these. I mean, there'll be some, but the first couple of chapters, you learn all the basic prefixes and all the basic suffixes. So you don't keep having that many every time. You know, eventually you'll have had them all. So don't worry about that. You'll do it. But on the other hand, make sure you learn the ones we're talking about today. The suffix "-ion" means a process, contraction. Yeah, that's not a good example, but okay. A specialist, IS means specialist like cardiologist for heart, dentist for teeth. Itis, inflammation or infection. We talked about that. Rhinitis is a medical term for a runny nose. Cellulitis is an infection of the skin. Itis is one of the most important of the suffixes. Logi means study of, like biology, cardiology, the specialty of the heart. Oma means a tumor. Now, guys, not all tumors are cancerous. A lot of them are, but a lot of them aren't, although they still may require treatment. Carcinoma is a cancerous growth that derives from epithelial tissue. And I know you probably don't know what that is yet, but you will soon. So the suffix "oma" is very important. It means tumor. However, it doesn't automatically mean a cancerous tumor because there are many benign tumors also. Although carcinoma is a branch, it's the largest category of cancer. Osis means condition. Like if you have a curved spine, when you look at it from the back, it should be straight and it's curved. That's called a scoliosis. See, osis is curved spine. Opsy means viewing, like microscopy. Means looking in a microscope at small things. Scope means to view, or very similar to what the other one, but the microscope is the actual instrument. Microscopy is the use of a microscope. Okay, pathy is disease. This is really important. We mentioned it before. Cardiopathy is heart disease. Myopathy is muscle disease. Apathy or pathy, very important one. SIS, state, condition, Y, general. These are generic endings. Tomy means to cut or make an incision. Tracheotomy, yeah, is where they make an emergency cut in the trachea, the windpipe, so you can breathe. Prefixes, small words that come in front of the word. A or an means without. Anuria means you're not producing any urine at all. Important one. Auto means self, like autobiography is a person's written a story of their own life. Dia means through, like the diameter. The diameter of a circle is a line drawn straight through from one to the center to the other. Endo means within. Epi means above. We talked about that. Ex or exo means outside, like exterior. Hyper means more than normal, like hyperactive, or hypertension, high blood pressure, higher than normal. Hypo means less. Hypotension, less, low blood pressure. Can you have low blood pressure? Oh yeah, definitely. It can be serious. These are super important. Learn them right now. N just means in. Peri means around, like the perimeter is a distance around a circle. Peri means around. Pro means before or forward. Re means backward or behind, like to rewind a tape. Retro means behind something. Sub means below or under. Perfect example they're already using here is a submarine. A vessel is under the water. Trans means across. Like a trans-Pacific flight means it's a flight going out across the Pacific Ocean. Okay, pronunciation. Most of this, guys, comes just with practice. As I do these videos, I'll try to make it evident how it's pronounced. But this is just like I hopefully you learned in grammar school years ago. If it's got that straight bar, it's like it's A as in ape. It's the long sound. If it's got this little smiley looking, it's the short one. Like here's A as in ape, A as in apple. See, it's not the same. The capitalized syllable is the one that's accented. Now that's something, guys, that comes with practice. Let's see what it says. Like adenitis. Now adeno means a gland. Itis means inflammation of. But it's not adeninitis, it's adenitis. Bial. The capital's where the emphasis goes during the pronunciation. Biology. Cephalic, not cephalic. Cephalic. Iatrogenic. The emphasis on the gin part. Resection, not resection. Resect. Again, guys, you just have to learn these with practice, Quick quiz. Which term means inflammation of a gland? Well, what's the root word for gland? Can everybody say adeno? So is it adenoma? What does the suffix oma mean? It means a tumor. Is a tumor inflammation? Not necessarily. What's the root word for inflammation? It's itis. So is it arthritis? No, arthro means joint. Arthritis is like, in a joint. On the other hand, adenitis, that's it. Why? Well, because adeno is the word for gland and itis is inflammation. So bingo, the answer is B. Quick quiz. Which term means the study of cells? Now, what's the root word for cell? I'll give you a hint. It's cyto. So that eliminates D. Is it? Well, actually, it eliminates everything but C, because this is cysto. What's cysto mean? Urinary bladder. Cyto means cell. Ology means the study of. Bingo, there it is right there in black and white. I think we're about finished. Which suffix means to cut out or remove? Well, itis means inflammation. Scopy means to check something out with an instrument. Opposite we haven't mentioned. It's ectomy, like a tonsillectomy, a hysterectomy, etc. Okay, guys, we finished early. Go back in and make sure you know these words in this lesson today. Make sure you understand the suffixes, the prefixes, the root word, the use of combining vowels. When to use them, when not to use them. You don't use a combining vowel when the suffix starts with a vowel. You drop it out. If you have two root words like gastroenterology, gastro and entero are both root words, you keep the combining vowel in there regardless. Okay? Now, guys, I want to reassure you, in the third and fourth week, you will not be learning more prefixes and more suffixes. You'll get all those in this first week or so. Hang in there, get them down, study them, learn them. You got to memorize them. Just do it, How do you memorize it? You just keep going over it enough until you remember it. That's how you do it. It helps to have flashcards. If you want to make some, go on Quizlet, and they have some, and you can look at it. It's a great way to study this type of thing. Let's see. Yeah, make sure you know the major prefixes, the major suffixes. And after that, guys, once you get that down, then you'll start going by the system, the anatomical system. In other words, you'll start studying the nervous system and the words that are relevant to it, and the cardiovascular system and the words that are relevant to that, and so on. Okay? Make sure that you got these basics down. It's real important. What else was I going to say? Also, too, Dr. Y and I are redesigning this class. We're rewriting these PowerPoints and stuff. I didn't do this one, but to make it match, because we've started, or he's the boss, started the students taking anatomy and physiology, the same module they take medical terminology 1. And I think that's a good idea. So we're modifying these PowerPoints in this course to match the anatomy ones. But that's good, guys. That way you'll be exposed double to it. The more you're exposed to it, the more you will learn this stuff. I've been teaching college a long time, and I don't have any fancy theories about education. I think education is extremely important. But to me, this sort of thing, and a lot of anatomy and physiology, guys, it's just stuff you have to just remember or memorize. Sometimes in education, I don't like to use the word memorize, but I disagree with it. That's exactly what you're doing. A great deal of learning is memory work. So what? What else is? Would you thought it was something different? I'm rambling on, but actually, we got about 30 more seconds and the video is going to end. These videos I do through Screencast-O-Matic, but you can only do 15-minute ones at a time. Guys, if you haven't watched it, look at that Keys of Success video. It's very important. Hang in there. Keep your eyes on the prize. The prize is to graduate. Keep your eyes on the prize. See you next time. This is Dr. Tom signing off.